Mothers or teen parents, for lack of a better word, now find themselves dealing with are environments that are harsh in terms of the socioeconomic statuses that these children find themselves having to quickly grow up and quickly be parents and provide for their children, quickly learn the wings and the ropes around childcare, and be emotionally available when they're still kids themselves. So we really are excited to hear more about what this report findings are saying, and some of the issues that we as civil society organizations really need to be identifying with, we need to be looking out for, and we need to be engaging with duty bearers on as we implement programs within our jurisdictions, but also as we engage with policymakers on various issues to do with teenage pregnancy and how we ensure that these teen mothers' lives are not so disrupted that they can't have a future, and perhaps a future that can also ensure that their own children would benefit from. Sexual reproductive health rights issues, we can't overemphasize the need to now focus on them, and we are excited that even this year in May we saw the committee of experts actually making a general comment on sexual reproductive health rights as a result of the day of the general discussion that dealt with these issues. And for us, the general comment now facilitates for African states to now use that as a standard measure and guideline in terms of what needs to be in place and what they need to be reporting against as they give periodic statuses and progress around what it is that their countries are now dealing with moving forward in ensuring that issues to do with sexual reproductive health rights, and particularly that which affects adolescents, is taken care of or is addressed. Having said that, we are looking forward to the rich panel that we see that is going to be discussing these issues, learning from them, and ensuring that the learnings actually translate into programmatic and advocacy work that can change the landscape in terms of changing attitudes, changing mindsets, but over and above that, that it facilitates for a conducive environment in which children, adolescents, and young people can really grow up in, knowing that they do have their rights in matters of reproduction and sexuality and health really looked out for, and that they can access information, the right information that really do help them to make informed decisions about their lives and about their bodies and about their minds as they engage in life generally. I can only assure the African Population and Health Research Center, together with your partners, that the civil society organizations we really are available, and events such as this one really do add value in terms of capacitating us, but also giving us the much needed evidence, because in many times when we engage in such conversations, we are asked about the evidence. So if we find evidence such as this one, it really does add value in terms of our advocacy initiatives, because we would have evidence that facilitates for us to really engage with policymakers from an evidence-based platform. So thank you so much for that. And also to say that much as we are building capacity and getting the evidence, we are also learning new things, because even ourselves, as we implement initiatives on the ground, as we know, as civil society organizations, we play a dual role, that of a watchdog in terms of advocacy and monitoring whether or not policies and laws are being implemented, and identifying gaps where they are being implemented, and pointing out those gaps. But we also do play another role where we play a complementary role to government and become a service provider and ensure that everything that we are doing, everything that we are doing does complement what is on the ground. So this report really would help us to ensure that we also improve our services, we improve our interventions, and that our interventions and services do become services that add value and make a difference to children, adolescents, and young people, because they are evidence-based. Once again, you are welcome to this side event by the African Population and Health Research Center in collaboration with their partners and the CSO Forum. Please do feel free to engage in the discussions and to really ensure that the report is working for all of us. Ultimately, we are servicing the same client, and we need to ensure that we have done all that we can to analyze the findings and ensure that these are understood, and that these facilitates for us to do a better job in changing people's lives on the ground. Thank you so much.
Thank you very much, Felicitas, and we totally appreciate all the work the Civil Society Forum under your leadership is conducting, and being able to bring together various voices from across the continent through the civil societies, and being able to articulate some of these issues that adolescents face at different angles. So we appreciate you also talking about the different frameworks that are there, the Africa Child Rights Charter, the UNCRC, the work that the civil society is doing in terms of being the watchdog, and also keeping the committee on their toes on matters that really affect adolescents. Thank you so much, Felicitas. It's an honor to have you here. All right, so ladies and gentlemen, we are now, great. Ladies and gentlemen, we are now moving to the panel discussion. You might have met our panelists a while earlier, and we have a mix of panelists in the essence that we have the voice of the youth being represented. We have the voice of the civil society. We have the voice of researchers, and we have the voices of programmers, those who on a day-to-day basis do their work around ensuring that adolescents across the continent are able to receive the right care and the right protection as envisaged in the African Charter on the Rights and Welfare of Children. We are talking about survival, development, and growth and well-being of adolescents in general. So this particular side event is very keen on observing a number of issues. We have for the longest time, and even taking into account COVID-19 pandemic, there have been a number of issues that adolescents have faced with regards to health. It's their ability to access healthcare. It's their ability to enjoy what they term as their basic rights in the continent. And so this particular panel discussion is aiming at looking back at what we have been able to achieve in bringing forth the rights of the adolescent but also at the same time, having worked in a space of a pandemic, what more do we need to do beyond COVID-19, and also looking at the things we've learned, the emerging areas that we need to embark on to ensure that adolescents receive the right healthcare and well-being from all of us as stakeholders. So it's great to have you all panelists, and without further ado, I'll pick on every one of you at different stages. I'd like to begin with Josephine Achieng Odhiambo, who is the program person at the Youth Changes Kenya. Josephine, very recently, we've seen lots of adolescent sexual reproductive health commitments coming from the governments, and we've had discussions. In fact, currently we are having discussions on the East Africa Community SRHR bill. We've also had the Essa, East and Southern Africa commitment on SRHR conversations ongoing, and would like to hear from you what really is coming out as different, especially with regards to the East and Southern Africa ministerial commitment on SRHR. What are the priority areas are we seeing in this next phase of the Essa? Over to you, Josephine.
So like I mentioned, my name is Josephine Achieng Odhiambo. I work as a programs person at Youth Changes Kenya. So we are a community-based organization that promotes sexual reproductive health and rights for adolescents and young people, particularly for adolescent girls and young women. We work in peri-urban and rural areas. We currently work in Nairobi, Kakamega, Kiambu. So in terms of the new commitment, there is a lot of new areas that is being focused on, because the previous commitment was governments are expected to develop a comprehensive sexuality curriculum for young people in school in their countries. They were supposed to eliminate sexual gender-based violence, but then this new commitment brings in an aspect of mental health, which was not there in the previous commitment, which young people are very happy about, because mental health is an issue that has been affecting a lot of young people. Also, the commitment has areas of a monitoring and evaluation area, so that people can be able to find out what have they been doing in their countries, what are the challenges they've been experiencing. And to just point out, given that currently there's a lot of conversation on Essa, a lot has been happening. We've had consultations, regional consultations, in-country consultations, sort of like just find out what the plan is for Kenya in terms of recommitting. And I would like to point out that a few weeks back, there was a regional consultation on Essa where countries were present. Each country was giving feedback in terms of what they've done in their countries. And as a young person who has experienced a few SRHR issues, it saddened my heart that the Ministry of Education was not present. Kenya was not represented. They were not able to give their feedback in terms of what they've been doing. And that just shows that when it comes to CSE, there's a lot of opposition from religious students, from the Ministry of Education itself, the partnership with young people and Rapid Response Task Force, which has over 20 organizations present. We've been doing a few activities just to, one, create awareness on the commitment to young people and to the general public, and to just put a lot of pressure on the Ministry of Education to recommit. So far what we've done is we've delivered a demand letter to the Ministry of Education. Unfortunately, we've not received any feedback on it. We published a press statement. We've had a few TV interviews with young people. We've had the young people themselves write articles on the commitment, but still no feedback. And the culmination of all the activities that we did was last week on Friday. We had almost 32 young people who took part in a procession that we did last week. So we walked in the CBD to the Ministry of Education. We delivered a press statement as well. We chanted on the streets, just sharing information on Essa and why it is important to young people. And I think that was very good, because this was done by young people themselves with the support of DSLs, of course. But it just shows that young people are at the forefront of pushing for the government to recommit on Essa. That is how I would respond to your question.
Thank you so much, Josephine. And I love that you've highlighted that this is a collective call, especially among young people, being able to take charge, as opposed to before, where we see other people really pushing for their rights as adolescent. But in this case scenario, we are seeing a lot of young people. You've talked about 32 young people marching forward to claim their rights. And it's so interesting to see that the aspect of mental health is coming out strongly in this particular ministerial commitment, something that in the previous commitment has not been broadly addressed, has not been exhausted, and being seen as a priority area. When we talk about the ASRH, this is quite a step in the right direction. Thank you, Josephine, for your reflection. I'd like to bring in another young person in the panel. We have Gladwell. Gladwell, already Josephine has brought something very interesting, and I say that young people have come out strongly to spearhead the conversation on SRHR. And you being a youth champion within the IPAS Alliance and at Africa level, would like to hear from you and understand how can we enhance youth agency in tackling emerging ASRHR issues in the continent. Over to you, Gladwell.
Okay, thank you, Juliet. My name is Gladwell, a youth champion with IPAS and also founder of Women for Sustainable Change in Nakuru. And there are different ways in which we can enhance the agency of young people. And I like what Josephine has brought out, that young people are taking leadership. However, there's still minimal engagement. And we see that organizations, and I've also seen like Youth Changers Kenya, they would forward some of these groups. And we've seen these with those to other organizations that are forwarding these opportunities to young people. The government, which is really important, especially when it comes to rural setups, where we have young people who are championing for the rights of young people, but they do not have opportunities or platforms in which they could use. For example, I would like to go right down to places. I would speak like, for instance, in Nakuru, we do not have as we would want to have. And we do have, like Josephine said, we do have commitments. We have not seen is not as we would expect, especially from the policymakers, and also if it's guidelines from that is from the service providers, so that they're able to provide services for young people and also engage young people when making changes and developing or building structures for the youth-friendly services. When it comes to engaging young people, it is not just about having young people sit at the table, but it is also by building the capacity of young people in order for them to be able to have meaningful contributions, and they're able to understand the issues. And for example, I'm sure we do have programmers, they're able to understand programming, so that when we have CSOs that are youth-led and are coming forward in leading issues to do with SRH, especially to do with young people, they're able to address their issues in different ways, especially when it comes to their projects or initiatives within their community. They're able to program their work well, based on the issues that are happening on the ground. And this can only take place if young people have the capacity to do so. And this comes from building the capacities by big organizations. We've seen organizations that do build capacities of CSOs or upcoming CBOs. We've seen building of capacity by young people themselves. For example, the network in which also Josephine is working, when you've seen they would build capacity of different CSOs within their levels as young people. And it's unfortunate that in as much as we talk about meaningful youth engagement, we still have minimal engagement with young people when it comes to issues, especially like, for example, public participation, which is a very vital tool, especially when it comes to change. And we know that we have very few young people and women. Let us not even talk about adolescents. It's very hard for us to even have adolescents engaged in this. And we assume that young people may not really understand. However, when I like to look at it this way, when we're doing our research, we would go to the young people. But when it comes to implementing programs, when it comes to the government implementing the guidelines and the policies, where is the adolescent? Where is the young person? And this makes it very difficult because what strategies are you putting in place? Are you putting in place strategies that would support young people? Because a young person would easily tell you the kind of service they would appreciate. So you end up developing programs that a young person is not comfortable with. And of course, that would be like a waste of resources, having put in place programs that young people are not comfortable with. And we're seeing there are new ways in which we can engage young people. We have the client-centered approach. We have, when it comes to HIV, we have differentiated service delivery. And we don't have service providers who are aware of some of these strategies to ensure that young people are accessing services. And we have social media. I think that is one of the best ways in which we could address or we could engage young people, because social media is providing platforms for young people, and it's also a platform for where young people socialize and network. And we get to build families as young people on social media. And this would be a very good opportunity, if well tapped in, to have or mobilize more young people when it comes to agendas to do with SRHR, so that young people can also be on the front line when it comes to advocacy. And it's only advocacy. It is so that young people are aware of their rights and are able to exercise their rights and enjoy their rights in their country, in their communities. And social media would be one of the ways. We also have engaging young people in I had mentioned before, like public participation. And I know there's minimal engagement because sometimes young people may not have the resources to participate in some of these things, especially I've personally experienced this when it comes to rural areas, and sometimes we have to facilitate for their transport, which is a bit difficult. And if some of these issues are addressed, especially when it comes to resources, so that young people are able to engage in such opportunities where they're able to air out their issues, they're able to state what they want. And as a young person, I've seen sometimes it's difficult for a memo that we've written as young people to go through, because probably from the area I come from, I will present the memo. However, maybe if my county has 7 sub-counties, maybe it's only 1 sub-county that gets to submit that. So it will be put aside because we don't have a voice. We don't have so many young people coming together, giving at least one voice, because some of them are not able to afford to participate in some of these activities. And as starting CBO, we may not be able to facilitate for everybody, and especially not even everybody within the CBO itself. And this is not only happening to us, but it is happening across the country. I'm sure it's also happening in other countries as well, where young people don't have enough resources to participate in some of these activities, including participating in the review of policies at the national level, and also when it comes to participating in the regional, in the development of regional documents, or giving feedback or reporting. And it's not only resources, but also the capacity to do so as well. And I'm not sure if there's anything else that you'd like me to add or I've forgotten to mention, but I'm sure as we go along, I will answer more questions.
Well, Gladwell, you've really expounded on everything we need to know about, at least most of it we need to know about recruiting youth agency. And I love the fact that you're saying that you're able to pinpoint the spaces that the adolescents are missing in the public participation. And it's a matter of also resources. How are we able to bring them to the public sphere, to be able to participate in these discussions around policy? But also importantly, you've mentioned that they might not even have the content or the capacity to discuss this policy work if nobody has broken the policy work to a language that they are able to understand, and a language that they're able to use and interpret and contribute to the discussions. So I really find that very interesting, and points that you brought forward. I know for sure we'll be having a couple of questions and commentaries towards the end of the panel session, and you'll be able to address them at length. Thank you so much, Gladwell. And then next in line, we do have Vanya Kibui. And Vanya has for a while been designing and implementing programs around health, and especially adolescent sexual reproductive health. And Vanya, your space is around a lot of work around ensuring that governments are able to be held accountable, that the frameworks they put in place are able to be utilized, and we can hold them accountable to whatever policy work, whatever framework they've put on the ground on matters to do with health. And I'd like to know from you, would like to hear from you, how are we able to track government's accountability mechanisms on adolescent sexual reproductive health? Over to you, Vanya.
Thank you so much, Juliet. I hope I'm audible.
Loud and clear. We can hear you loud.
Thank you. Thank you. Yes, as you have said, together with you and many partners, we have been involved in tracking government accountability for commitments made. However, as we have seen, the gap is in the real results of the welfare and the quality of life that our young people and adolescents are living. And so, despite the robust human rights framework we have and the long-standing civil society action as evidenced by improved human rights standards, I would say over the last 50 years, accountability is largely hinged on commitments made as well as clearly defined duty bearer, I would say, legal or policy obligations. So what we decided to do as AMREF is invest in the decision makers understanding that the decision-making process needs to be hinged on the principles of inclusivity and integrity. So thereby enhancing the capacity of community-based and more formal government structures in their ability to create enabling environments for young people and adolescents to engage in. Therefore, a meaningful youth engagement framework and a girl-centered design of programming and decision-making makes sense because the young people become the center of the decision-making, the consultation, the dissemination, and everything that involves the policy process. So we've done this at different levels. At the community level, the Africa-led movement that is led by the Center of Excellence against FGMC and harmful practices at AMREF focuses on accelerating the pace of the change of achieving results when it comes to ending FGMC and other harmful practices. We are looking at really investing in the capacity of the adolescent in all spheres of her life, whether she's at school and even engaging school-based decision-making structures, even out of girl, I would say minors who are like mature minors in terms of what we call them legally because they were married or when they were children. So enabling empowering their capacity to engage cultural and community-based decision-making structures. So the idea of, for instance, the girl-centered programming, where girls are placed at the center of and the heart of program design, implementation and evaluation, is because the practice affects and impacts the girl all around. So if we're able to sensitize the decision makers, community leaders on how and why young girls need to be involved in the decision making. It also creates an environment for for adolescents and girls and young people to then get engaged and share what it is they feel they need and what their priorities are. At the subnational level, we're looking at emerging issues like teen pregnancies. I wouldn't say they're emerging in terms of new, but ever since, for instance, with the COVID-19 pandemic, it showed that, whereas teenage and unwanted pregnancies were happening, the priority in how to address them wasn't as urgent, right? So in that way, it became an emerging issue. But on the other end, we also have policy priorities that have come up. So the subnational level, through campaigns centered around Gender Equality Forum, we have another campaign called our Essa campaign that's based at the county level. We've created we worked with young people to create what we're calling action groups. And these action groups are then embedded and integrated within the decision-making structure, the formal decision-making structures in government. And they co-identify and co-create solutions that are then backed by policy action through implementation frameworks, budgeting commitments, and other kinds of, I would say, government and program-based actions that then continuously involve young people using a meaningful youth engagement framework to make sure that the governments are actually implementing priorities that young people say they want. So this is the same vein we have kind of elevated at the regional level through what we're calling the Youth Power Hub. Now, the Youth Power Hub is looking at platforms such as what this webinar is engaging, like the CSO Forum, looking at the Essa commitment, the East Africa Commission, the EAC bill on SRHR, and other regional commitments. The idea here is to, one, invest in the capacity of young people to know what commitments are there, what are the pathways for engagement, and how do you hold policymakers accountable for their commitments. But it also acknowledges that not every commitment will have kind of a policy outcome. And so we have disaggregated the accountability pathways to include political commitments, the dimensions rather, the political commitments, we have legal, we have public expenditure, so that we can expand the platforms upon which young people can keep policymakers accountable. But this capacity is enabled by digital tools. We have a social accountability course on the Youth Power Hub online. We can share the details on that. We also have a Youth in Action advocacy curriculum. They're all led to capacitate young people with the effective advocacy tools on how to get actual policy change. Beyond that, we have now young people work together. We work better when we work together and when we leverage on our movements and our numbers. And so those who are trained are given the platforms to support others to also learn. So a training of trainers model has been seen as being very beneficial when it comes to capacity strengthening. So at the general, so the commitments and indicators we have span around economic, social, and global commitments, looking at national policies, cost and implementation plans, frameworks on SRHR in general. So they're not only, I would say they're multi-pronged in terms of how we engage policymakers. In summary, as AMRIC, we're focusing on investing in grassroots capacities to achieve SDGs and regional development commitments. We encourage decision makers from local level all the way to global level to invest in community-driven, transformative understanding and perspective on what constitutes knowledge and expertise and capacity of young people, because young people know what it is they want. And investing in their capacity means that we make the voice of the young person the center of our policy decisions and the center of our implementation focus. So therefore, the one recommendation we would make alongside I would say, the CSO Forum and this session of the Committee of Experts is that we need to strengthen pathways of engagement for young people, and the onus here is not only on young people in engaging, as we've heard from my previous speaker, is that we can't create rules of engagement that then don't capacitate young people to engage. So if we have consultative processes, then it is upon us as influencers, decision makers, and structures to then make it possible, even in terms of resources, for young people to actually engage. So this means engaging adolescents and young people in the consultation of what priorities are and what we consider to be important and should be covered in commitments, for instance, with the Essa commitment. In deliberations, young people need to be in the room. And so our meaningful engagement framework, for instance, supports policymakers to actually even be introspective in how inclusive they are in the decision making. Are young people in the room, and are they contributing to the decisions? In the drafting, even in language. So language advocacy is a big deal, as we know, at regional and global level. So young people still need to be in the room. They need to have the tools, they need to have the data, and they need to have the wherewithal to negotiate with leaders, and eventual in dissemination. Because once we have ownership of young people and adolescents on the decision making being made in a way that they can see evidence that their lives are reflected in the decisions, then it will be easier for governments and other institutions and departments to work with young people to disseminate these policies to service delivery level, for instance, so that young people can actually get the eventual services, because the evidence of all this work will be in the improved livelihood and lives and well-being of young people and adolescents. Thank you.
Fantastic, Vania. And I love the fact that you're able to see that nothing can be done without the presence of young people. And for them to actually be there, they need to understand the issues. They need to also know what their role entails. They then also need to know, what's the broader picture? Because most of the times we sort of bring young people to just talk about the moments of the day, but then they realize that there are policies, there are frameworks that go beyond that one day, discussion with them, one day co-creation workshop with them that actually impact their lives. And the fact that they are able to see along the way what has been gained, what has not been done, and they are able to engage further. That's quite an interesting space to build their capacity on. I know already we are seeing questions streaming on for you, and especially with regards to what really has worked. But put that somewhere in your piggy bank. We are about to. We'll come back to you with that particular question. Now we have had a lot of emphasis on how we can include the young people in advocacy on their own rights on SRHR. But we have not had which are these, all the content that has been developed, the research work, the evidence, which affects young people. Which of these areas have not been tapped? What kind of evidence does Africa need to not be monotonous about talking about SRHR rights when we talk about child marriage, when we talk about FGM? Those are areas that we've gathered a lot of research on, but yet there are areas that, or issues young people are facing that have not seen the light of day in terms of evidence and in terms of interventions. And that brings me into the last session of this particular panel, which is we are going to have Anthony Ajay, who is an associate researcher at APHRC, who is going to let us sort of bring us to light in some of these things that we really didn't think that are areas of focus in research at Africa level. And Ajay would like to know from you, which are these under-researched areas when we talk about the health and well-being of young people?
Thank you very much. Thank you very much, Juliet. I hope you can hear me.
Loud and clear.
Oh, great. So, I mean, through the project I work on called the Challenging the Politics of Social Exclusion at African Population and Health Research Center, we've embarked on a review of evidence to just understand the research that are there and areas needing more evidence. But to support the scoping review that we did, we also held a co-creation agenda with civil society organizations, with academics from universities, with policymakers, and even young people to sort of look at what areas, again, based on their work, that they are seeing that there is a need for evidence. And my talk will be on those, on the products or the findings of those two activities. And I'll probably share the link also through the chat box. So I'll begin from this scoping review. For the scoping review that we did, we saw that there are lots of research over the past 10 years on sexual behavior of young people, age at sexual debut. There are lots of research on HIV, treatment adherence, and even intervention to support adolescents living with HIV in particular. But in terms of what is missing, or areas with limited research in Africa, you would notice that areas like STI, there's very limited evidence on STI, sexually transmitted infection, other than HIV. There's also limited information on adolescent youth-friendly services. Of course, on the policy front, there's a lot of information, but in terms of research to assess and see how those youth-friendly services are running, there's also limited evidence. And also, issues like gender norms, they are critical to because those are some of the formative areas that lead to poor outcomes in the future. For example, young people that support wife beating or that tolerate wife beating are more likely to be exposed to sexual and intimate partner violence, both now and even across the life course. So issues of gender norms have also received limited attention. Even menstrual hygiene, there's limited attention in terms of research. And then besides all these other broad topics that came out from the scoping review, we also saw that the evidence, even the available evidence, is skewed to only 6 countries. Only 6 countries have close to 80% of research on adolescent sexual and reproductive health in sub-Saharan Africa. 6 of the 46 countries, in sub-Saharan Africa. And then if you include even North Africa, you see that the evidence is skewed to only South Africa, Kenya, Nigeria, and then a few other countries, Ethiopia, and then 2 other countries I cannot remember. But then, so we are basically saying in that scoping review that the research evidence on ASRH is limited in terms of scope and then in terms of geographical coverage. So even when we are saying there is evidence on certain topics, it might be that the evidence is not available in other countries. So the evidence might just be in Kenya, in South Africa. Now, in terms of also what works for program implementation, because we need a lot of data to show what works in improving outcomes. So implementation research on comprehensive sexuality education is lacking. There are few evidence, again, in all those 6 countries that I mentioned, but these evidence are generally limited in terms of the robustness of the evidence on say, implementation research on comprehensive sexuality education, because we need to invest more on what works to improve adolescent sexual and reproductive health. There's a lot of advocacy now on Essa commitment to improve, to ensure that young people have access to accurate information. But again, from the research point of view, we also need to be able to demonstrate that. And then we need long-term data. We need to invest in long-term data, that track adolescents, say from 11-year-old to like 19-year-old, and be able to compare those that have access to accurate information versus those that do not have access to accurate information. Let's say the outcome across the large course, because oftentimes people, people rely on anecdotal evidence to say that comprehensive sexuality education would, increase or promiscuity and and other stuff like that. But again, there's no evidence backing that up, and that's one of the reasons why we need implementation research to demonstrate that, at least, or otherwise. So those are the evidence that came out from the scoping review that we did. But again, to speak to how policymakers are thinking, how civil society organizations are thinking. So I would like to also share briefly on what came out of the co-creation or agenda setting workshop that we had in 2019 here in Nairobi. Through that workshop, civil society organizations as well as policymakers are kind of clear on what evidence they want to prioritize, or what questions they want answers to. And so for them, it's important that we generate, evidence on, comprehensive sexuality education. It came from our scoping review, and it also came from the agenda setting workshop. So there's a lot of appetite now for researchers to then generate evidence on comprehensive sexuality education, implementation research on comprehensive, as well as even adolescent youth-friendly services. Some countries are already implementing adolescent youth-friendly services. So we need, again, to conduct monitoring and evaluation and continue to generate evidence to improve outcomes in that area. Also, there is a need to generate evidence on the impact of child marriage on the well-being of girls. And this also came from the co-creation workshop. Also, there is also a need to conduct analysis of legal and policy provisions addressing age of consent to SRH services, because there's a lot of I think the issue of age of consent has largely been understood to be protective of adolescent sexual and reproductive health, or to be protective of girls themselves. But now the laws requiring parental consent could actually, result in denial of services. Say, for example, if a young 30-year-old seeks access to condom in a facility, and then is turned back to go and bring the parents to consent to say issuance of condom. I'm just using condom as an example. I know that young people actually get condom from pharmacists, not necessarily outside facilities, but there are services they may need in facilities, say like pre-exposure prophylaxis, or even post-exposure prophylaxis. So if parental consent is required for such services, they may never get the service because they may not, inform their current parents, because it means that if you inform their parents, the parents then find out that they're having sex, which they may want to keep secret. So we know from research that young people value their privacy. So requiring parental consent may actually hinder their access to services. So the civil society or the stakeholders we brought together wanted us to generate evidence by conducting legal and policy review across sub-Saharan African countries to also help them understand the impact of these laws or policies or the laws on age of consent. And then there's also a need, lastly, it also came out from the workshop that there's a need to generate evidence on the priorities of vulnerable populations, because we do know that adolescents are not monotonous. There are groups that are more vulnerable than the others. So even as a part of our approach, when we generate research evidence, we need to consider the vulnerable adolescent population. Say, for example, like the pregnant and parenting adolescents. Oftentimes our attention is on preventing teenage pregnancy, but then what happens to those ones that got pregnant? And we know that the numbers are quite substantial on the continent. So there's limited research focusing on the implication of pregnancy, how pregnancy compounds their social exclusion, for example. And even here at African Population and Health Research Center, we've taken that agenda forward, the one on pregnant and parenting adolescents, and we're beginning to develop intervention to support pregnant and parenting adolescents, again, to help them to look at intervention that can, empower them, both in terms of the academics for those that want to return to school and for those that want to also be empowered, say, in terms of, learning trade and all that. So we want to see low-cost intervention that over the next few years, we will be generating evidence on what works to empower adolescent girls that got pregnant. I'd like to stop there, but as I said previously, I'm going to share the link to these documents, both the reviews as well as the co-creation research agenda, and then people can, read it again to have a better understanding of what I'm trying to explain. Thank you, Janet.
Wow, thank you so much, Anthony. And I love the fact that it's very clear and based on your experience on the areas that as a continent that we've not been able to gather enough evidence. And it's such a surprising, really a rude shock to imagine that only 6 countries out of, hypothetically speaking, 55 countries in Africa that have been able to generate sufficient, or it's something really like recognizable data on SRHR. That's really an alarming, scenario. And the fact that if we are looking at that long-term kind of interventions on ASRHR, what other evidence will these other countries have to be able to use and to program or come up with incentives, come up with programs to help these adolescents, young people? So I think there's a very urgent need to expand on more countries being able to jump into the research work and get enough evidence to inform their policy work, to inform their programming work. I love the fact that you are able to say there's other areas such as STIs, youth-friendly services, gender norms, the legal aspect of, the legal consent of adolescent exposure to sex and also marriage in general. And that really has a very huge contributing factor to the kind of interventions that young people deserve, and even their voice to be heard and their ability to make decisions as who they are. So thank you so much, Ajay. Ladies and gentlemen, we are opening up to all your questions and your reflections based on the rich conversations we've had with the panelists. And if I would again call upon the panelists, I'll call out your name because I see a lot of people putting for the questions and comments with regards to what you have presented. And I'd like to begin with Josephine. Josephine, there's a question that was raised to you, that what can we do? All of us in this call apparently has put us up to task. Can we do to support the work on the East and Southern Africa commitment, the Essa ministerial commitment? What do we think we can do as civil societies?
Thank you for that question. And I think one of it has been said in terms of because most of the time when you talk about meaningful engagement of young people, we usually address it to government most of the time. But I need to say that it also needs to apply to CSOs when they're having consultations on Essa. When discussions around CSE are happening, young people need to be engaged meaningfully. And when I say young people, I also mean an adolescent need to be present. For most of the time, it's just the people who are above 18 that are there most of the time, which is fine, they're young people. But then as Josephine, I cannot speak to the needs of an adolescent because I am not an adolescent. So adolescents need to be actively engaged in those conversations, and just young people generally in all their diversity. Because engaging Josephine does not mean you've engaged every young person. No, we are different and we have different needs. That's one thing. And then the other thing would be to just push for the government to recommit, because we've seen a lot of laxity from the aspect of the Ministry of Education. There's a lot of laxity in terms of them recommitting to it. So just showing your support for the campaign that we'll be doing online, just reaching out in case there's anything you want to be engaged in support in terms of what we are doing. And then also to just push for, because with the previous Essa commitment, as a country, Kenya, we didn't have a national accountability framework. Because young people were like, okay, this commitment is here. So how do we hold the government accountable? What structures can we use? So just pushing and advocating to ensure that there is a development of a national accountability framework to ensure that when this commitment is signed again, we are able to track what's happening and not wait until when the commitment elapses for us to start tracking what has been happening. I think that would be really good. And I think the other thing that would be very important is these CSOs are working together, yes, but then it'd be great to have, because we have community-based organizations, that we have youth groups that are also doing activities on the side at the community level to just push for the same agenda that we are doing. So it would be great to have all CSO being engaged, youth groups being engaged in the conversation about Essa at the national and at the region level. That's how they can sort of like assist in this fight, as I would put it, to ensure that young people have access to comprehensive sexuality education in and out of school.
All right, thank you. Thank you so much, Josephine. And I also see a comment from Elsie that says the active participation of the youth is very important. Strategic, interesting conversations indeed. Strategic partnerships enable sharing of resources for advocacy and other civil society organizations. That is very true. As civil societies, we not only need to gather enough resources for our own running, but also being able to engage our constituents, being able to create solutions with this adolescent. And I believe it was you and Gladwell that mentioned that it's important to provide even the resources needed for these people to show up at a meeting at the Capitol, show up in a meeting at the community level. And that's really much important. And again, Elsie is coming up, has asked another question. Kindly share success areas where decision makers were held accountable through policy and program action to domesticate national, regional, and global commitments. I think, Vanya, this is your question. Give us like one or two scenarios where there was a success in decision making in terms of holding governments accountable on policy and program action.
All right, thank you so much for that question. I think my answer is also going to kind of really connect to what Josephine was saying in terms of where we place the responsibility. So the success I can share is what we did with one of the youth initiatives on Network and AMREF, which is Youth in Action, YACT, that Josephine is a member of. And the approach that we used for this was to identify the policy priority issue with young people and by young people. So the focus of support was, yes, in terms of seed funding, in terms of the grants, but mostly in terms of the advocacy capacity to develop effective advocacy strategies. So the focus of the advocacy strategies was then the policy priority issue, and not only with one organization, but coalition building was part of this. So what am I saying here? Youth identified policy priorities that are not by one youth-led organization or one group of young people or advocates, but by a group or a representative community of youth advocates in that area or in that country, then building an effective advocacy strategy through that. That's why for us, capacity strengthening tools are very key to this, because we believe capacity is one of the most important sustainability approaches we can have for both public and private sector, because then it means that the expertise lies with the communities, right? And so they can continue the work beyond that particular priority issue. So there were several priority issues, for instance, that were worked on in the last, I would say, 2 years, in this example I'm giving. And one of them, for instance, was mental health management as a priority issue in Kilifi County. So when the youth coalition went to the county, this was not, I would say, like a high level priority issue, but young people and adolescents said this was a need. So based on even research and information and data that the young people had, one of the things was to negotiate with the county to have this priority issue adopted as a priority issue. And it was through the Essa recharge strategy for the county. Eventually, that was I would say, a positive outcome from this negotiation. And then from that, I co-created like a partnership and a collaborative process of developing mental health management policy for the county that now exists and is waiting to be launched. This was the same process in a different county, which is like Samburu County. And we can share case studies actually. I've just seen Anthony sharing links here. And when I'm on break, not speaking, I'll just put them in the chat so that you can have access to them to see what the youth-led coalitions actually did to get this, I would say, successes. And so as I was talking about Samburu County, for them, the policy priority issue was youth-friendly services. And the issue here in terms of domestication is this. Sometimes a young person, often, even if you're in an urban city, in whatever country you're in, you may not know what's happening in terms of your regional economic bloc, or even so much at the national level or at the global level. But if we integrate the priorities in terms of language, in terms of asks from young people, because young people know what it is they want. So if we deduce that into the asks, into what the priorities are, and then have those included into community level and subnational policy advocacy engagements, it means that there's an eventual reflection of global commitments in international work. Because one of the things that we need to invest in is making the gap smaller in terms of where it is young people feel they have the influence. Not every young people is going to have access to the Africa Committee of Experts, right? And not every young people is going to have access to the subnational, I would say, in my version, the devolved level of government, but they will have access to the community level. And so if we leverage what it is they know and what it is they know, and then add on to what they don't know in terms of what the eventual result of the commitments would be: access to information, access to services, training of healthcare workers, investing in the capacity of youth-led organizations or young people, then that means we get to achieve big gains without necessarily using, I would say, big language in terms of what the commitments are at regional level, if we make it more tangible and more practical. The final bit in terms of, because I know she talked about, the question was also in terms of private sector. The other investment has been investing in the organizational assets of youth-led organizations. And for us, we have a bias on young women-led organizations. And organizational assets here looks at organizational development and system strengthening. What are your even petty cash systems, HR systems, so that youth-led organizations, even at the grassroots level, can operate at a high functioning status, so that you can even attract funding from non-traditional funders, even including the private sector. Because one of the things that we have seen that we can't completely run away from is the formalization of how funding occurs, right? So because of accountability and integrity, we need to be able to track. And at the same time, we need to be able to invest in organizations being able to do the work, so that as INGOs and big national level, regional level CSOs, we can get out of the way and invest in grassroots capacity for young people to do what it is to do the work, rather, that's what I'm saying, and continue working with, I would say, formal and cultural decision-making structures, so that the impacts are more cumulative. For those of us working at the regional level, we know we're using the same language. At the global level, the same thing, and the sustained impact stays and is invested at the grassroots level as well. Thanks.
All right. Oh, thank you so much, Vanya. I think you've been able to, that one thing I've picked from your explanation is how young people have the ability to flip the priority areas of governments. And I'd like to bring our expert in youth agency in this conversation, Gladwell. How do you think young people can actually flip the priorities of government, like what Vanya has explained as a success story? Gladwell?
Yes. Well, I think I might repeat what Vania and Josephine have actually said, and it's most importantly when it comes to building the capacity of young people. It is true, young people do know what they want. And having had the opportunity as a young person and also having worked with young people, it is different. What is presented to young people and what young people actually request for in terms of what they want in terms of services, it's different. And I'm happy that we also have Anthony, who's also brought into light that there are so many areas that we've not had research on. And these are the areas that should really be brought forth when it comes to addressing issues of young people. And I like how Vanya has brought it out, building the capacity of CSOs. But also we have organizations in which, big organizations, or rather, NGOs or INGOs that have membership of young people and young women. So how then do their structures engage young people? How do their structures engage young women? And it is important building structures that would support and would hear out the voices of young people. It's not just hearing out the voices of young people, but how then do you take into account and are able to implement some of these things that young people have asked for? And after that, how then do you follow up? How do you give feedback on how young women and how young people have been engaged so far? Currently, we don't have, both from the government, let's talk from the government, where they're able to get feedback on how young people have written memos and have given asks. What happened after that? What was implemented? What did they consider? What was not considered? And it's sad that young people do take part. It's sad that we do have young people who have the zeal and are working so hard to give memos, and like Josephine said, they still haven't had their feedback. And how do we then hold the government accountable if we don't even have anyone who's reporting back on, this is how we've been able to consider what you gave us, and this is why we were not able to do A, B, C, D. So I think it's a blind spot, because now you don't know what you're supposed to do next. The next time you want to do these activities and you want to advocate for issues of young people. And to add on to what I think Anthony also talked about research, I'd like to bring out something. It is important that also as we talk about issues that young people are facing, it is important to have data, it is important to have science. And we do address issues of culture a lot and would say, maybe culture does not allow this, religion does not allow this. But what I've found to work is that sometimes they're not even aware of what really happens. There's a lot of science behind what happens to an adolescent. There's a lot of it of what happens to a young people, to a young person. And I like the way that young people are bringing forward mental health issues, because they are so interlinked, because you cannot separate an adolescent with mental health. Why? Because they are facing changes, and psychologically, for those, that is according to psychology, that is the age where they are seeking identity. And you see, if we cannot link the fact that this is somebody who's seeking identity, and at the same time they do have issues that they're facing and they need information as they seek identity, so that we avoid young people getting into risky behavior. And if we cannot link all this together, it makes it even more difficult when it comes to pushing for agendas. And if right now we were to look for research, it's very hard to find research when it comes to mental health linked to sexual and reproductive health. And it is also difficult to get data when it comes to young persons living with disability and their SRH needs within the country, what has happened so far, what programs are there. Even if we wanted to program our work according to that, to what is really happening, it's difficult for CSOs or even the government itself to program its work to address such groups within the community, and especially young people, if we don't have enough data. And and I think it will all begin by engaging young people. Just as Vanya said, a young person needs to be at the center. So we need to have youth-centered programming where it starts with a young person. And at the end of the day, while doing evaluation, the young person is part and parcel of it as well. Thank you.
Oh, thank you, Gladwell. And I continue seeing lots of thoughts and comments from our participants with regards to a discussion here. Elsie talks about Botswana, the fact that Botswana has tried to generate statistical data on SRHR through population-related research and census. Socio-cultural concerns are problematic and pose a threat to the collection of data, given the reluctance of families to share. And I just want to pose a question to Ajay with regards to this comment. Have we had scenarios, would we attribute the fact that there's some resistance even from the people that are expected to give us this information to be able to share the non-conventional areas of research? And in the event that you as a researcher and other researchers have come across scenarios where there's resistance of giving away information about specific cultural issues, what becomes of it?
It's such an interesting question. Contexts differ even within across countries. So, generally, if as a researcher, people value their confidentiality, their privacy. They want to be assured that whatever information they give you remains private and is not shared, especially with their identifying information and all that. So I, for one, I've conducted studies that people are reluctant to share. But again, my own conclusion from that experience is that there needs to be more investment in guaranteeing confidentiality, in ensuring privacy and all, because that's what helps you to generate quality data. So there are certain information that you want to generate that it has to just be generated in private, because SRHR issue in our context is a little bit a no-go area. People don't want to talk about sex. So we just need to invest in data collection structures that guarantee privacy, and those structures are already there. There are information that people may not want to discuss, but they may want to write to you anonymously. So those are alternative ways of gathering such information. So I'd like to stop there, but I mean, a lot of resources online on how to approaches to generate data on sensitive issues. Yeah, thank you.
All right, thank you so much, Ajay, for that. There's a question from Alvin. I am unable to put it in my perusal. Christine, if you've been able to spot Alvin's question, please pose it to our panelists.
Sure. Mwangi asks, what are we missing when it comes to strategies and interventions to SRHR, adolescent and young people? Unfortunately, as a young person, I feel like we have been speaking about the same issues, proposing solutions, but are we seeing progress? I guess that's a question that can go to all the panelists. So again, the question is, what are we missing when it comes to strategies and interventions what are we missing when it comes to strategies and interventions on SRHR, adolescent and young people? Unfortunately, as a young person, I feel like we've been speaking about the same issues and proposing solutions, but we are not seeing much progress. Why is that so? What's the missing gap? I guess all panelists can answer that. And
who would like to go first?
Yeah, let me go first. Okay. I was at an event together with Juliet last week, and the moderator challenged us to do better when it comes to participating in elections. These are issues. These are our issues. we've been working on these issues. Maybe it's time for us to try different approaches and perhaps also be involved in electing people that can represent our interests. And I think that's one thing I probably would say, okay, let's do something differently. Let's be involved. Let's go for political campaigns. Let's ask questions about people contesting, ask them our questions about SRHR, maybe they can even say, oh, come and be my advisor on this SRHR thing, because we often assume that our political leaders know about SRHR, but some of them, in fact, many of them don't know about it. When you use terminologies that like comprehensive sexuality education, they probably think you are talking about, LGBT, for example. They don't know what you are talking about. So there is a need for us to engage more, both in terms of being an active citizen during elections, raising these questions to politicians in their campaigns, and voting for those that you believe would deliver on these or these priorities. It's one thing we can be doing differently. That's one blind spot that we are not thinking about, but I think it's important that we engage politically. Thank you.
Okay, that's fantastic. And Josephine, just checking with you. What can we do different? The question is around what can we do different? I mean, you've given us a spectacular outlook on what needs to be done in capacity building of young people, in packaging the kind of information put out there. But what is it amongst all those things you've done and as civil societies have done, can we do differently?
I think the one thing we can do different is most of the time we see when young people give recommendations, they actually, yes, we take into consideration. And then when you see the intervention or the policy that has been developed, it's totally different from what you're saying. So what usually happens is you'll give out an intervention that you want to be done. Maybe they didn't understand what exactly it is. So they assume, maybe you wanted to say this. So they tweak the intervention to turn out into what they think you are saying, as opposed to just coming back, propose this. Kindly give us around the holistic young person, because when you talk about persons with disability, many a times they're left behind. Even when you're organizing our own meetings, usually a blind side from our end as well. When we are as CSOs, when we are having consultations with them, a simple thing as having a meeting venue to be inclusive and cater for the needs of that person with disability, it is very important, because if you don't factor that in, that young person will not engage in that discussion. So we need to move beyond just having young people give their recommendations, but actually taking their recommendations into action. And in case you don't understand what they are trying to say, reach back to them and ask them, as opposed to you assuming you know what they were talking about. I think that's one thing we need to do differently.
Fantastic. Gladwell, your final thoughts on that?
I'll just add on to what Josephine has just said. Also, when it comes to M&D from the government side, also, if you follow up on, especially when it comes to budgeting and all that, you'll find that there's a repetition of so many projects that we don't know whether they've ever been done or they're just replicated in the same budget over and over again. And for the crucial parts that we would like to have the budget increase, then we're not able to do that, because then where is the follow-up, the reports, and that is one weak point when it comes to the government. And when it comes to what Anthony said, I think, God, he just read my mind. When it comes to politics, wow. When it comes to politics,
Bonsoir.
We need.
Yeah, hello, what do you feel?
Yeah, just 1 minute, Honorable Eljera. We are hearing from Gladwell.
Yes, okay.
Yeah. So when it comes to politics, this is also a place where also young people's voices are also not really heard, or young people sometimes may be afraid to venture in that area. But I think it is one place that, because these are the same people who sit in those positions and influence policies, and they'll be busy making bills and all these things. But if we don't consider the kind of leaders that we have, if we don't put them to task even before we give them these positions, then I guess the next time you vote in somebody who takes you back again 5 years, and then you guys have to start, have to wait again. Then you have another leader, then maybe who's progressive. Then again, you have a leader then who probably takes you back again. And we need to reconsider that when it comes to advocates, as CSOs, as young people, as adolescents, regardless of whoever the person is. We need to ensure that this person have the interests of the people at heart, especially when it comes to reproductive health. And another one is when it comes to program design. We write proposals, or people would write proposals because, we need to write the proposal, we have a call, and so many CSOs write these proposals. But how many of them would call young people and adolescents, or would seek the opinion of adolescents and young people while they're writing these proposals? How many of them? And it's very difficult to implement a program that has not had, you've not had the views of young people and adolescents. And that is why you'll find there's so many loopholes when it comes to addressing issues of young people. Even as CSOs, you'll find that you're running out of time, you've not been able to achieve your objectives. You're not able to reach the young people that you want. There are so many gaps, and we are reporting on the so many gaps that are there. But did we even go to the community in the first place to figure out what exactly are the young people issues that the young people are facing? How exactly do we address them? And what exactly is the issue? Some, it could be cultural issues, some it's structural issues, others, maybe the setup is totally different. But if we go with an assumption of the data, and sometimes if you're using the government data that probably, for example, most people would use KDHS 2014 in Kenya. 2014 is so many years ago, you would need recent data, but you would use data that was already there to implement a program that you didn't even involve young people. Then when it comes now to evaluation, and the donor is here, like Josephine said, when the program is way, it's actually almost ending, then engage a young person. Then it beats logic, and it's difficult to even come up with anything. But if programs engage young people from the beginning, I think right now we would not only be talking about how we are supposed to engage young people, but we would be addressing the gaps that after what we've done, after engaging young people, these are the gaps that we have. And these programs would actually work as they would be providing evidence on best practices. We should be providing evidence to the government on this is what works when it comes to youth-friendly services. So we are saying that because we've tried this, we think we should do this in our government facilities because we've already done it and we've engaged young people and it has worked. Yes, thank you.
Thank you, Gladwell. Thank you for such rich reflection. We are almost coming to the end of the program, side event program. I would just like to give Vanya 1 minute to just respond to that question and tell us what we need to do differently.
Thank you. And I really do feel Alvin's sentiments, because sometimes when you do advocacy for so long, it feels like you're by yourself shouting in like it's echo chamber, or even if you're in the field, it's not getting anywhere. Just to encourage all of us and say that there has been some progress. And I think the number one thing we need to do differently is look at what has worked. And then in terms of what's not working, I think we need to work together, because everything Gladwell did when AMREF launched UI Act, that is exactly the template that we used. And we have seen the evidence of like positive results from that in terms of building networks, in terms of getting positive policy change, in terms of having a sustainability plan, of having them integrated into government developmental frameworks, in terms of having young people in the room contributing to what priorities should be all the way to department level, and including budget advocacy. So the changes and the positive outcomes are in terms of Africa, when you're looking at one county in one country, it may look very micro, but I think it's promising. I think there are promising approaches, even in terms of what Josephine was saying on Essa commitments and how we are working together. I think they're there. And what we need to do is replicate and expand them, which takes me to advocating for co-funding for youth-led organizations. I think that over and above putting our governments to account in terms of what their commitments are, I think there's also kind of a development partner aspect to this. Because youth-led organizations can only do in as much as they're capacitated to do. So co-funding will enable youth-led organizations to continue doing the work and sustain it. And then I wanted to say that the last one is the change for how we even begin programming through a meaningful youth engagement lens needs to start from an institutional perspective. And so for those of us who are on the call and are not in youth-led organizations, for instance, I'm not youth-led, but we took the road of doing hard things and launched a youth strategy that then had us as an organization be introspective at, if you don't even have I'm looking for an English word that has disappeared in the afternoon. But if you don't have a good number of people represented in your own leadership, in the design of programs, you can't expect to have a youth lens in doing that. So for instance, WIACT is different because WIACT is completely youth-led, youth-driven. So it's even the leadership is young people, but now at an organizational perspective. So my challenge is that as well. And then finally, I think there's a hard conversation that we are not willing to have in as far as comprehensive sexuality education, for instance, and considering what it will mean to have sustained gains. The reason I'm raising this is because COVID-19 almost wiped out like 50% of the gains we had made in SRHR. So we need to go back and look at what had them be at such a risk, and having those difficult conversations within ourselves as civil society and with government in terms of how are they being resourced? Are they being resourced only by development partner funding, or are we pushing the governments to actually allocate earmarked budgetary allocations for those needs, so that what adolescents and young people need for health services, education, and all of that is not displaced by other things or other needs that come up. Thanks.
All right. Thank you. Thank you so much, Vania, for sharing that interesting, observations in general, in terms of what needs to be done differently and where we need to invest differently and all that. Ladies and gentlemen, it has been a fantastic panel discussion. I believe we've been able to pick a thing or two in terms of how we can capacity build adolescents, what governments can do different in terms of resourcing, designing, and rollout of all the interventions around adolescent sexual reproductive health. We've also had about the way and the manner in which the youth can conduct business when it comes to seeking interventions that affect them. We have heard about how we need to engage them, what they need to talk about, how they need to package their information, and the kind of support they need from the rest of us as civil societies, as policymakers, as leaders at the African Union. And as we come to those of this particular discussion, I know Honorable El Jazera just rejoined us, and welcome back, Honorable El Jazera. And we have just wrapped up a very rich conversation, but there's one thing that we feel that you can take like 3 minutes to let us know that we have these great plans in civil societies to engage the young people. I know with the committee and the CSO forum, there's a day set aside for children actually to come and share their experiences, to share their voice and what they feel and think, that the committee of experts can support them, can fast track their voices for them to be heard in the kind of interventions that need to be on the ground. And one thing we've also had that there's a limitation in terms of evidence in the continent on SRHR issues for adolescents. And you sitting up there as a committee member in the Africa Committee of Experts on the Rights and Welfare of Children would like to understand, aside from the evidence you're generating on teenage pregnancies across the continent, what other areas are you generating evidence on? And in that respect, we'd also like to know, to what extent are you engaging civil society in generation of this evidence and in documenting the kind of work that you're doing as a committee? Honorable Elgera.
Vous m'entendez? Merci, Madame Juliette. Merci, Madame Juliette. Effectivement, tout le travail qu'on fait sur la santé de la reproduction et sexuelle des adolescentes est documenté. Et on a un secrétariat qui compile tous les documents et rapports faits sur la santé de la reproduction. Mais on a des domaines où nous sommes très confrontés. C'est par rapport à la liberté sexuelle. Et le fait que les adolescentes puissent disposer de leur corps, ça pose un frein, surtout au niveau des pays dits musulmans. Au lieu de parler de la liberté sexuelle, ils préfèrent parler de l'âge du mariage. Limiter l'âge du mariage à l'adolescence, à l'âge de 18 ans. Par exemple, au niveau de la Mauritanie, le code de santé personnelle limite l'âge de la fille à 18 ans. Toute fille à 18 ans révolue peut se remarier, peut se marier librement, mais avec le consentement de son tuteur. Tout ce qui est contraire à la religion, tous les pays et musulmans membres du comité ont eu des réserves par rapport à la liberté sexuelle et droit à la reproduction. Au niveau de la Mauritanie, on a une loi sur la santé de la reproduction qui définit les actes que doit bénéficier toute femme ou fille venant faire des soins en santé de la reproduction. Donc, c'est un défi pour le continent et qu'aujourd'hui, les pratiques néfastes sociales posent un problème à l'accès à la fille à des soins de santé de qualité. On aimerait vraiment, de concert avec la société civile, et je vous informe que le comité a des lignes directives pour avoir le statut d'observateur. Comme que la SPCR travaille sur la santé de la reproduction, vous pouvez faire la procédure d'avoir le statut d'observateur au niveau du comité. Vous pouvez faire entendre votre voix et vous allez entendre des paroles au cours des sessions officielles du comité qui se font chaque 6 mois. On a 2 sessions par an. On aimerait, si vous n'avez pas encore eu le statut d'observateur auprès du comité, de faire la procédure. Je suis en contact avec Juliette. Elle peut m'envoyer par WhatsApp son mail. On a déjà son mail. Je vais lui envoyer les lignes directives pour avoir le statut d'observateur qui ne demande absolument rien. C'est avoir la loi, la réglementation sur la loi des pays où opère l'ONG. On a besoin d'avoir un rapport d'activité sur le droit et bien-être de l'enfant que l'ONG mène dans ses activités quotidiennes. Et vous allez faire une demande officielle adressée au secrétaire du comité que vous voulez avoir le statut d'observateur. On aura en interaction avec la société civile. La société civile travaille. Aujourd'hui, il y a des ONG qui ont le statut d'observateur, qui assistent à titre d'observateur aux sessions du comité et qui peuvent, s'ils le souhaitent, avoir un temps de parole dans les plénières. Donc, il est important que le Centre pour la santé de la reproduction, s'il a le statut d'ONG, il peut faire la procédure d'avoir le statut d'observateur d'OEC au niveau du comité. Donc, le comité travaille avec toutes les organisations de la société civile, mais celles qui ont le statut peuvent prendre la parole et peuvent même céder en justice, peut être partie pris dans des pays où on a vu qu'il y a des violations de droits des adolescentes. Donc, il est important que malheureusement que je n'ai pas eu le temps, je vais vous présenter le comité, le mandat du comité qui est de l'article 32 de la Charte africaine des droits et bien-être de l'enfant. Le mandat ainsi prend le mandat d'util aussi de son article 32 qui mandate le comité de protéger et de promouvoir les droits de l'enfant sur le continent. En tant que rapporteur spécial sur la santé, j'ai un mandat de tâches très clair pour promouvoir et créer des partenariats aussi bien avec l'État qu'avec la société civile pour faire avancer la santé, en particulier la santé de la production des adolescents. Donc, voici l'économie de ce que fait le comité. On a tous nos documents, tous les rapports qu'on fait, le rapport qui est en cours sur la grossesse des adolescents sur le continent. Une fois le rapport est validé, présenté par le consultant, on va le partager sur le site du comité. Je vais vous envoyer le site du comité. Vous pouvez consulter tout le rapport que le comité a fait. On aimerait que vous preniez connaissance de l'agenda 2040, où il y a des aspirations très claires qui permettent aux États de prendre des mesures, aussi bien en allant de l'enrichissement de l'enfant à la naissance, que d'avoir accès à la santé. Et les aspirations mandatent aux États de prendre des mesures alternatives pour essayer de permettre aux adolescents d'avoir accès à des soins de santé de la production. Donc, voici, Juliette, l'économie de ce qu'on fait. Et tout ce qu'on fait comme document, c'est documenté. On a des rapports qu'on peut trouver sur le site de l'ONG. Merci, Madame Juliette. Je vais juste faire ma bénédiction priée et retourner vous voir. Merci.
Wow, thank you very much. Thank you very much, Honorable Eljera, for pointing out the specific entry points that we as civil society need to do to be able to work with the committee to drive matters on adolescent sexual reproductive health. I believe this is a call to all of us to be able to apply for the observer status of the committee, in order for us to be given a floor like what we've had right here, right now, to engage the committee directly, to be able to give these specific recommendations that we are putting forward as civil societies, as young people in this particular area of reference. So thank you so much, Honorable Eljera. You remain our very resourceful partner.
Oui, il n'y a pas de problème. Juliette.
Yes.
OK. Juliette, vous pouvez m'envoyer vous m'envoyez un mail et je vais vous envoyer les directives pour avoir le statut d'observateur et je vais vous expliquer par WhatsApp.
You the form to ask her how to get the observer status. Thank you very much.
All right, that is noted, Honorable Eljera. I'll also share with every participant that joined in our meeting today that form that will be shared with me and the necessary links that we need to be able to engage with the committee. I will definitely do that. Thank you so much, Honorable Eljera. A hearty appreciation to also all our panelists for such a great job. I can tell even from the attendees that they enjoyed your remarks, they enjoyed your reflections, and we are truly grateful for that. I'd like to hand over to Christine to close the event for us. Thank you. Over to you, Christine.
Thank you, Juliette. Thank you so much.
Juliette. Merci, Christina.
Thank you, Juliette.
Merci.
Thank you, Christina. I'm going back to the other meeting.
Thank you so much. Thank you, Honorable Eljera. It was really a pleasure to have you together with...
Okay, bye-bye. Bye-bye.
Bye. When we set out, one of the objectives for this meeting for us was to have our discussions today captured in the Africa Committee of Experts on the Rights and Welfare of Children, and going by the discussion and what Honorable Eljera has pledged, we are there. We have achieved that as one of the objectives. We were also privileged to have Felistas who gave us an overview of what the Africa Commission on the Africa Committee of Experts on the Rights and Welfare of Children is all about. And really that helped us to shape our discussion today on emerging trends in adolescent sexual and reproductive health and rights. Our panelists took us through a variety of approaches they're using, as well as some of the gaps and how to keep government accountable. And we also got to hear from one of the panelists about some of the ongoing documents that we need to be aware of and start championing the Essa commitment on CSE. So check out that. If you're not aware what the Essa commitment on CSE is, kindly There are links being shared in the chat section. Check them out. You can also Google a very free tool that can be your friend. The panelists, of course, have really shed a lot of light on the issues that are emerging in terms of adolescent SRH. And I wouldn't want to belabor the point by repeating some of those. I just want to go back to a question that was asked to the panelists because it really spoke to me as somebody who started off working in the youth movement and has now transitioned to now being a programs person. Like, what do we need to do different? What can we do different? And I like how the panelists answered that question. I just wanted to add a few things that we can do that I have seen sort of making us achieve some progress. So I would say, for example, as youth people, as young people, I'm still a young person by African Union definition. We are mainly looked at as, we're not looked at as experts. We are looked at as the people who come to, we are tokenized. We take selfies, we come to tweet, we come to take minutes, but not much about now having young people as experts, yet it's our life they're planning for. So trying to change that by occupying some of these spaces, taking these opportunities such as what Honorable Elgera has mentioned. Also, just trying to fish out of the usual and preach to the non-converts, where we are no longer just speaking to people interested in SRH, but we're also speaking to academicians, we are speaking to religious leaders, we're speaking to media houses, so that they in their own small spaces can become champions of what we do. I sometimes tend to feel that the usual suspects, if I can call some of us that, have people like, we know what, people have people thinking, okay, even before you open your mouth, people think they know what you want to say. But if we get different people from different spaces to sort of champion our causes, then maybe that could be a way. I'm not saying it could solve, but I'm saying it's one of the things we can look at even as we continue our advocacy and looking for a way to change the narrative around meaningful youth engagement and participation at all levels. So thank you so much. This has been an enriching conversation around emerging trends in adolescent SRH. We hope to have some of the, or rather we will have some of the discussions or outcomes from today reflected in the outcome statement by the CSO Forum. We will also be sharing a recording of this, and some of the links that have been shared will be available to you via email. Asante sana for attending, and yeah, ciao, bye, asante. Bye, I'm clapping.
Bye, thank
Yeah,
you.
bye.
Thank you, bye.
Bye-bye.
Bye.
Thank you so much.